Okay, so now we're going to talk about our practical back exam. I'm going to break these up into low back and cervical spine, so we kind of have two different sections here. But this is the exam that you can do in clinic that's going to get you the vast majority of all the things you need to do for screening. Make sure you have a good clinical exam, but they're not going to kill you in terms of time. So let's get started. We're going to start with the low back here. We're going to start in the seated position. For inspection, we're going to first start by just looking how they're sitting. Are they leaning one way or another? If you can, get their shirt up over their back so you can at least look at their spine, make sure there's no big curvature there. And then palpation, we're going to palpate the spinous processes for any step-offs. We can then move more laterally into the soft tissues like the paraspinals or in the glute potentially. And then if they're pointing, saying they have pain in the SI joint, we also want to palpate the SI joint. Now we're moving on to strength of the lower extremity. We're going to test L2 with resisted hip flexion, L3 with resisted knee extension, L4 with ankle inversion or dorsiflexion, L5 with great toe extension, S1 with resisted ankle eversion or plantar flexion. Then we're going to move on to reflexes, and for this we're going to do the patella and the Achilles reflexes. Then we're moving right into sensation, where the L2 is the upper thigh, L3 medial knee, L4 medial shin or medial malleolus, L5 is web space, and S1 is the lateral foot. After seated, we're going to move into a lying position, and now here we're going to talk about special tests. If the patient has SI complaints, meaning they point and do the one finger test already saying this is where I feel the pain, then we can do more SI joint testing. And so if we're going to be doing SI testing, the patient's already pointing to it saying this is where I feel the pain. So they've already done the one finger test. Then we can do Gainsland's test, a compression test, distraction, a thigh thrust test, or Faber. And we got to cluster these together because no one test is fantastic. And then on top of that, when they're laid in their supine position, I'm also going to do my fader test to make sure I test their hip. And then the last one I do while supine is typically the straight leg raise. So they're lying there. I just have their leg in extension and just slowly bring it up to see if I reproduce any ridiculous symptoms going down their leg. And so after they've laid up, I kind of bring them up and get them into a standing position. And here I'm going to start with inspection and range of motion. I'm going to go take them through flexion, extension, rotation, and lateral flexion. And then overall, I'm just looking at how the person's bending, right? Looking, is they're really limited on one side? And I also try to look at them when they're bending from behind. Is there any sort of, scoliosis that I see in terms of uneven shoulder blades or curvature of their spine, or are they bending one way or another? Just general looking for trends. Then for the last one while standing, if we want to, we can do a special test looking for any sort of spondy lesion. We can run the Stork test. And overall, that is our low back test. We've gone through a lot of screening, making sure everything looks okay. It's not too intense, but it does take a little time because you have to go from seated to supine to standing, but it shouldn't be too bad. I hope that's helpful for you. Now we're going to move on to our cervical exam, and this whole thing can be done in a seated position. First, we're going to start with inspection, right? Does the patient have a turned neck? Is it asymmetric? Are they kind of stuck in a position? Next, we're going to talk about palpation. We're going to work down the cervical spine, make sure there's no step-offs or cervical spinous tenderness. Then we can kind of branch out there saying, hey, do they have any paraspinal tenderness or tenderness of the occiput or the traps? Then we're going to look at range of motion. So essentially here, we're going to have neck extension, flexion, rotation, and side flexion. And honestly, I just take them through a big circle to get a full range of motion. Now moving on to strength. If you think about the mnemonic, the blocker, beggar, kisser, grabber, spock, that'll kind of help you think about what we're testing, but typically we do it in a more systematic fashion. Typically I'll test like this. I'll do shoulder abduction, then elbow flexion and extension, wrist flexion and extension, then grip strength, claw grip strength, thumb extension, and finger abduction. And that covers all of those blocker, beggar, kisser, grabber, spock, but it does it in a more systematic way. Next, moving on to reflexes. And here we're going to do the biceps, the brachioradialis, and the triceps reflexes. Then moving on from there, we're going to do sensation. So C5 is the lateral deltoid, C6 is the dorsum of the thumb, C7 is the third digit, C8 is the fifth digit, and T1 is the ulnar side of the elbow and forearm. And then we're going to do our special test, which is Sperling's test. And so that concludes the cervical practical exam. Not too bad, not too long. Should be practical enough for you to do in clinic, but I hope that's helpful. Okay, so now we're going to go into our practical low back exam. We'll break this up between cervical and low back. I'm going to start low back here. This is a little atypical in terms of like you got to move a couple positions, and I'm going to simulate what it's like to be in a patient room. We're going to start in a seated position because a lot of times that's where we start the conversation. So we'll start seated, then we'll go to laying because I simulate like a table, and then we'll do standing from there. So same thing that we're kind of going through the same order, but we'll start at kind of real time how I do this. So first we do inspection. That starts when you walk in and kind of look at the patient and look from the backside. Are they leaning one way or another? Is there any big, spine curvature you're looking for? And then palpation-wise, all I'm going to make here is I'm looking for big step-offs. Make sure there's no big bony tenderness, and I can touch the paraspinal as well. I can also work into the glutes if they have lower pain as well to kind of palpate some things there. And then typically I'll do range of motion standing, so we'll come back to that. Next we'll do our strength testing here. So typically I'll say, can I have you bring your knee up for me? Don't let me push it down. So bring that leg up. Good. Don't let me push it down. Good. Relax. You can kick out into my leg here. Pull back. Good. Bring that toe up for me. Don't let me pull you down. Good. Push into my hand this way. Good. Push out this way. Push down. And you bring your big toe up for me. Don't let me push your big toe down. Good. Then I'll do things bilaterally as well. So here you bring the hip up. Don't let me push it down. Good. Kick out for me. Good. Pull back. And then bring that ankle up. Don't let me push it down. Good. Keep push out in my hand. And in there. Push down like a gas pedal. Good. Now bring that toe up. Don't let me push it down. Good. Fantastic. So that's our strength there. Now we're going to go into kind of sensation testing. And so sensation testing, we're going to start here. You feel me touching you both sides the same. And immediately, same thing there. And right here as well. And moving into the web space. That feels the same. And over there as well. Cool. Yeah. And then we'll do our reflexes here. So we'll just do our patella. And our Achilles. And we kind of compare sides as well. Okay. Perfect. And that's our seated, so we're just gonna move this out of the way real quick. All right, perfect. So now that we're aligned, we're gonna kind of go into some different special tests. We can also do additional hip tests if need be, but let's say they are complaining of SI joint pain. We can do all our SI testing here. So we can start with Gainsland's test. From here, move down. Okay, good, that's good. Next we'll do kind of our compression test here. Perfect. We can also do from this position, move over to the hip thrust test. Get under the sacrum, push down. Good. Now we can also do fay deer here. Get our hip testing as well. We can check our fay burr here on top of that again. And then we can also, anytime we're checking the back, we can always do a straight leg raise here. Good. And can I have you lay on your left side for me? All right, and right here we're just pushing down there. Good. And you can come on up and stand up now. All right, and then now standing, you can always start with this. A lot of times, like if you want to get them off the table, you can definitely do that. I'm just doing most of the time the most convenient one where, hey, if the patient's already on the table. But hey, standing here, we're just going to do inspection. We already did, kind of from behind, but standing we can do that as well. And then we can do range of motion. So can I have you bend forward for me? Touch your toes. Good. And from here, good, hold that position right there. We can actually look for like a scoliosis from behind here as well. So good, you can go ahead and come on up. And then can I have you reach on down by your side, then your other side as well. Good, and then can I have you go back for me, extend your back. Good. And then last one, can I have you rotate for me? Good. Good. And then if it's a pediatric patient, we can do stork test. So can you balance on one leg, your hands on your hips, and extend your back. Good. And so overall, that's pretty much it. There's definitely, you have to do all these special tests. If someone's not having any sort of SI pain, we can eliminate all those special tests. We can get rid of spondy tests. I kind of did this for completeness to show that, hey, this can be done really quick and still, very thorough. So hopefully that was helpful for you. All right, so now we're gonna go on to our practical cervical spine exam. This one can be done from the seated position entirely. We don't have to get them up and stand up or move positions at all. I'm gonna kind of talk through my thought process, so it'll take a little bit longer than normal, but I'm gonna show you that it can be done pretty efficiently here right in clinic. So let's get started. So first for inspection, I'm just overall looking at the presentation. Is their head cocked to one side? Are they turned? Anything like that? Then we're gonna go into palpation. Palpation, all I'm doing back here is I'm just palpating for step-offs along the whole cervical spine, make sure there's no bony tenderness. I'll kind of work up to the occiput too as well. Sometimes I have some trigger points, and I can also touch the traps to see if there's any additional trigger points there. Then for range of motion, I typically have them, can you bring your chin to your chest for me? Good, then extend it all the way back. Good, and then come back to neutral here, and then bring your ear to your shoulder. Good, and then the other side as well. Good, and can you turn your head to the right? And then turn your head to the left. Good. And can I have you do just one big circle for me? Awesome, good. So inspection, palpation, range of motion done. Now we're new strength. So can I have you bring your arms up for me? Don't let me push you down. Good. Now arms out in front. Don't let me pull you away. Good, now push out in my hand. Push out, can you bring these wrists up like this for me? Don't let me break you. Good, now flip them around like this. Don't let me break you. Fantastic. I'm gonna have you squeeze my fingers for me. Good. I'm gonna have you curl your fingers like that. Don't let me break your part. Fantastic, thumb up here. Don't let me push you down. Good, and then fingers out like this. Don't let me push your fingers in. And then while we're in this position right here, I'm going to kind of check some sensation as well. Do you feel me touching on both sides? Is that okay? Mm-hmm. No. And right here, do you feel that? Same? Mm-hmm. Good, and then third finger, feel that the same too?
Yeah.
And that. And then you have that the same? Good, you can relax now here. I'm just gonna check some reflexes, hanging right there. Good. Just relax for me, there we go. All right, and then we'll check, kind of compare how they are. And then next we're gonna kind of move on to a special test. We're gonna do a spelling test. I'm not gonna do anything quick with your head. I'm just gonna bring you back a little bit here, over the side. I'm gonna push down. Any problem or pain with that? No, okay. All right, and that is our entire cervical exam. Like I said, pretty quick, not a whole lot. It helps not having a bunch of special tests, but overall, once again, inspection, palpation, range of motion, strength, neurovascular special tests, and we're done. You just watched a clip from my Master MSK course. If you want to learn more about that, click right here. And if you want more related sports and lifestyle medicine videos, click right here.